You got your GBS results back and it's positive. And suddenly you're like, oh my gosh, my whole birth plan just got ripped out of my hands. You're thinking, does this mean I have to be induced? Do I have to get antibiotics? Can I still do this without an epidural? Do I even get the opportunity for a membrane sweep anymore? Or does GBS positive just take all of that off the table? Here's what I need you to hear right now before you go chasing down Dr. Google, girl, I see you, or go into ChatGPT at midnight. GBS positive does not steal your birth. I'm Trish, and I am a 16-year high-risk labor and delivery nurse, and I've been in the room with hundreds of GBS positive mamas. So today I'm going to go through every single thing you think this diagnosis just took from you and you're freaking out about. And I'm going to show you exactly what the research actually says, because a lot of what you're being told, it's not the full picture. And we're going to link to more information that I've created so that you have all the info. All right, GBS positive are two words that send a lot of you here. And I'm actually glad that they did. I'm Trish, labor nurse, birth educator, mama to 7, Gigi to 2, and someone who has watched way too many mamas cry over a diagnosis that did not deserve that big of a reaction. And I want to help you fix it. By the end of this episode, you're going to know whether GBS means induction, what the new research says about membrane sweeps, when you actually need to get to the hospital, whether you can still go unmedicated, and what your real rights are around antibiotics, including what happens if you say no. And I'm going to tell you what they're doing in other countries because it'll make you question everything you've been told. I pull my content straight from research and from being in the room with real moms. Girl, there is no fear mongering around here, no watering things down, nor there's no pushing you in any direction. In fact, Labor Nurse Mama was built from watching people push you into decisions. I just want you to know what you need to know. So let's get into it. Okay, let's start with what is GBS even? Like, we're going to go over that. Before we go anywhere, we're going to get clear on what it actually is. Group B streptococcus is a bacteria that lives naturally in the gut and the vajayjay. About 25% of all pregnant women carry it. Not because you did anything wrong, not because you're sick, not because you're dirty. It's just there. And most women who carry it never have any signs, zero symptoms. It doesn't cause you any harm. The concern is that during labor and birth, the baby passes through the birth canal and can be exposed to the bacteria. And in a small number of babies, that exposure leads to a serious infection called early onset GBS disease, things like sepsis, pneumonia, or meningitis. And let me just throw this out here, y'all. I've got some allergy things going on. So if I sound weird or I'm sniffling, that is why. Now, remember I said small number. I said small. And we're going to come back to that when we talk about the antibiotics. So the bacteria can also come and go. And that's why the test is done at 35 to 37 weeks. Now, some of you guys are getting tested earlier in your pregnancy. I personally would ask to be tested again. So you can test positive and then go into labor GBS negative, which is insane, right? Or you test negative and go into labor positive. Now, if you test negative and go into labor, they're not going to recheck you. This will come into play with some of the other points I'm making. If you test positive, they're probably not going to reject you. The 35 to 37 week window is like an imperfect window, no matter how you spin it. So let's go through every single thing that thousands and thousands of women have asked me on social media. And also thousands of women have asked me inside of my birth classes where we hang out on Zoom a couple times a month. So I get these questions often. Okay, myth number 1, GBS positive means you have to be induced. You do not have to be induced just because you're GBS positive. And I'm not sure where that actually came from, but it's definitely circulating, especially on social media. GBS positive is not a medical indication for induction on its own. The guidelines, which is ACOG and the CDC, they're not saying schedule an induction. What they're saying is when you go into labor, we want to get you on antibiotics. That's it. The focus is on what happens in labor, not on making labor happen sooner. Now, some providers are induction happy and they want you to come in 39, 40 weeks anyway. And maybe there are some other factors involved. Maybe they're legit, maybe they're not, but that is a separate conversation. If you're GBS positive, you don't have any other factors, you can wait for spontaneous labor. That is still very much on your table. Myth number 2, GBS positive means no membrane sweep. This is a big one right now because there is research circulating and some providers are using it as a reason to say no to sweeps for GBS positive mamas. But here's what the actual studies say. There's a study called the STRIP-G study, and a prospective cohort of 542 women, 135 of them were GBS positive, that looked at exactly this question. Is membrane stripping safe in GBS carriers? And the answer is yes. The rate of complications in GBS positive women who had a membrane sweep was like 5.9%. In GBS negative women, 8.6%. The GBS positive group actually had lower complication rates. There were 0 cases of neonatal sepsis, 0 maternal deaths. The researchers concluded that membrane stripping in GBS carriers does not adversely affect maternal or neonatal outcomes and should not be considered a contraindication. So if your provider is refusing to give you a membrane sweep because you're GBS positive, girl, that decision is not being driven by evidence. It may be driven by liability concerns, by outdated practice, or by habit, but the research is there and you can ask your provider to give you research or studies to show you why he's recommending it or she is, and ask them to review the study we just talked about. Now, here's the deal, and you need to listen to my membrane sweep episode, but a sweep still might not work. It only works if your body is like nudging towards being ready. And honestly, you need 2 or 3 of them, but you still have the option. It's still on the table, even if you're GBS positive. If you're pregnant and feeling overwhelmed, unsure about what really matters for birth, or hoping it all just goes well, this is for you. Most parents don't realize that it isn't effort. It's preparation that actually builds confidence. The Calm Birth Bundle closes that gap. It walks you through labor, birth, and your options in a clear, calming way. So you're not guessing in the moment or relying on someone else to decide for you. The goal isn't a perfect birth. It's a confident one. Right now, as a podcast listener, you can take $50 off with the code POD50. Go to labornursemama.com/calm, CALM. Get prepared, feel grounded, and go into your birth knowing you've done your part. Okay, this is a big one. Myth number 3. You got to get your butt to the hospital as soon as the contractions start. Okay, so this one is a little more nuanced, so bear with me. The antibiotics, penicillin is what is most commonly used. If you have an allergy, there's some other options. They work best when given at least 4 hours before the baby is born. That's the window the research shows gives the strongest protection. So the goal is to get those antibiotics in early enough in active labor. What this does not mean, you do not need to call your OB from the parking lot the second you feel a twinge. What it does mean is you need to be a little more thoughtful about your timing, especially if you tend to labor fast. So I have some rules, and we're going to talk about them. If this is your first baby, labor's going to be long, girl. That is the normal. You don't need to fly in at 4 a.m. contracting every 8 minutes. You go in when you're in active labor like everyone else, and they get the IV going. So my rules for you is you go in when contractions, normally for a first-time mom, you go in when your contractions are less than 4 minutes apart, each one lasting 60 seconds plus. Normally, I would say when that's happening, for 2 hours. For you to be a little safer, go in when it's less than 4 minutes apart, each one lasting for 60 seconds for 1 hour. You're probably still going to get there too soon, but that's going to give you more time if you're freaking out a little. Now, if you're not, wait till it's happening for an hour and a half. I roll on the edge around here. All right. So now, if you've had a baby before and you have had fast labors before, if your last baby came super quick, that changes things. You and your provider need to have a conversation. They're going to tell you to get your booty in there right away, but you're going to want to come in a little earlier than my first time moms just to make sure you can get the full 4 hours of antibiotics. However, if you're not planning on getting treated, that's out the window. Okay. But does GBS positive mean I have to race to the hospital at the first sign of labor? No, it does not. And in fact, you don't have to race to the hospital the minute your water breaks either. So I have rules for that. And you can find those on Instagram, or you can send us a DM and I'll talk about that as well. Honestly, at TikTok, I think I have it all pinned at the top. To be real, I don't know, but we have a reel for each of you for every scenario because I get all the questions. I live far. I'm GBS positive. What if my water breaks? What if it's my first baby? What if it's my second baby? We got it all covered. Okay. Myth number 4, GBS positive means you can't go unmedicated. This is one that I've heard, not as often, but I feel like a lot of times when something is different in your pregnancy than you planned, you think like, all my plans are out the window. And that is not actually true. Being GBS positive does not mean you can't have an unmedicated birth. What GBS positive means is that you'll need an IV or at least a hep lock. You could have it injected if you're not wanting an IV, but if you've ever had penicillin injected, that burns like a mother. So I'm not a fan, but they can place an IV, only have anything running to it when they're running the antibiotics. I do have a tip for y'all. If you're having antibiotics run into your IV, ask them to put an ice pack or a heat pack. I never know which is going to work for my patients, but that's just a little side nugget from Labor Nurse Mama. Okay. In between the antibiotics, you can have it capped and you're not tethered to a pole. Again, this is if you decide to be treated, because you don't have to be treated if you don't want to be. And I'm going to tell you what that looks like. If you have an IV capped or you're getting the injection, you can still move. You can still bounce on the ball. You can still be in any position you want between doses. You can still labor in the tub in many hospitals. Check your hospital's specific policy on that because some of them have weird restrictions. But whatever. That's a whole nother episode, girls. The IV does not run while you're in labor the whole time. It runs a short time and we do that, on a certain time schedule. In between, you're free to do whatever you're planning to do. An epidural is a separate decision. An IV for antibiotics and an epidural, not the same thing. I know y'all know that because you're smart. They are not connected. And being GBS positive does not throw your birth plans out the window. So if you're planning an unmedicated birth, girl, you can still do it. I promise you, it doesn't change it. All right. So now we're going to talk about the antibiotics and what you're actually deciding. So this is what I want you to hear me right now. You have a decision. I know it doesn't seem like it, and they probably don't present it that way. The recommendation is intrapartum, which means during labor, antibiotic prophylaxis. Okay. That means antibiotics during labor, just in case. Most commonly, penicillin. If you're allergic to penicillin, there are alternatives, but your provider needs to know about that allergy and they need to know your sensitivity level so that they can pick a alternative that works for you. So that conversation needs to happen well before labor. Let's talk about the actual risk numbers because it matters. Without antibiotics, about 1 to 2 out of every 100 babies born to GBS positive mom will develop early onset GBS disease. With antibiotics, that risk drops by about 80%. So roughly 0.2 to 0.4 per 100 babies. That's a pretty meaningful reduction. And early onset GBS disease, when it happens, is serious. I don't want to scare you. I'm going to be real here because I was floated to postpartum one time and I had a baby that it ended up being that it had early onset GBS disease and it scared the bejesus out of me. So I don't like to fearmonger you guys, but I want you to make this decision. Now we caught it. There are signs. So you can make the decision for you. But if this baby gets this early onset GBS disease, we're talking about a baby who will end up needing the NICU and could potentially have long-term effects. The risk is very real. But I also want to acknowledge that the vast majority of GBS positive moms without any antibiotics will still have a healthy baby. The risk is not zero, but it is not a guarantee of harm either. Now, do you have to take the antibiotics? You do not. You have the legal right to decline. No provider can force treatment on you. What I hope you'll do if you're considering refusing is to have a real conversation with your provider, not a confrontation. Like, girl, you get to make the choice. So have a conversation. Talk about your specific risk factors, because GBS positive isn't the only thing that matters. There are some other things that could, that you may have risk factors that I don't know about. Now, if you do decline, what happens? Here's the thing. And you may not like this. If you decline, they are going to treat your baby as if they are on a higher risk watch for GBS. So they're going to watch them more closely. And most hospitals will insist that they have to stay for 48 hours, which, if you don't know, if the doctor recommends it and you don't want to do it and you leave, you have to sign out AMA. Now, I can't 100% confirm this, but someone told me in the hospital system that if you sign out AMA, your insurance does not have to pay for the visit. So that could be a problem. But here's the thing. Your care team will monitor for signs of infection, fever, breathing problems, behavior changes. In many hospitals, again, that means a longer stay, and potentially they'll want to do blood work on the baby. So you need to know that going in. This is your informed choice to make, not a fear-based choice, an informed one. Now, what are other countries doing and why should it make you think? Here's something that in my own research I found extremely interesting and doesn't really get talked about. The United States does universal screening for GBS. We test everyone at 35 to 37 weeks. That's the CDC protocol. Now, again, some people are getting tested early, but we're talking about this one. Other countries are not doing it the same way. The UK, in fact, does not universally screen for GBS. They use what's called a risk-based approach, meaning they offer testing and treat based on risk factors, like maybe you had a previous GBS baby, or GBS was found in your urine, or you have a fever in labor or preterm labor. They don't screen every single pregnant woman. In fact, most of Western Europe, Canada, and Australia also have varying approaches. Some do universal, some risk-based, and some a combination. And here's what's interesting. The rate of early onset GBS disease across countries are not wildly different. In fact, the UK rates are very low. They're not seeing massive GBS outbreaks because they didn't screen everyone. So what does that mean? It means the conversation about GBS is not as black and white as it gets presented to you at your 36-week appointment. It means there's a legitimate global disagreement about the best approach. It means you are not living in a world where one protocol is the only protocol. Does that mean the US approach is wrong? Not necessarily, but it does mean you deserve to know that it isn't settled universal science. It is an evolving conversation and you're allowed to be a part of it. It's your birth. So here's what I want you to carry out of this episode. GBS positive does not make you high risk by default. It is a factor. It is a piece of information. It is not a sentence. It does not automatically mean induction. It does not mean no sweep. It does not mean you race to the hospital at midnight at the first twinge. And it does not mean you give up on the birth you wanted. What it means is that you need good information, a provider who will actually talk to you, and a plan. That's it. If they're shutting you down without explanation, without showing you the evidence, you are allowed to dive deeper, ask more questions. You're allowed to say, can you walk me through why you're recommending this and show me why? You're allowed to get a second opinion because this birth is yours. If this episode made you feel some relief and gave you something valuable, please share it with a friend who's pregnant, because I'm so sick of fear-mongering and people not knowing their options. Text it to your pregnant friend who just got her GBS results or who's getting ready to get tested. And like I said, my team is going to link a bunch of information about GBS in the show notes. Post this in your birth group, because these are the conversations that should be happening at your 36-week appointment and too often aren't. If you want to go deeper on understanding your rights in labor, not just with GBS, but across the board, I am your gal. So stick around. We have a new episode every week. And We 100% adore you and want the best for your birth. You are so valuable to me. I'm obsessed with changing the birth culture, and that starts with you. So again, hit subscribe, leave us a review. I am asking a favor because it means so much, and it lets me know like what landed with you and what questions you have and what you would like to hear more of. So please leave a review, leave a comment, and I will see you again next week. Bye for now.